Good morning, everybody. Thank you for being here with us today. Welcome to the Metabiome and Endodontic Tour 2019. Before starting, I would like to express my gratitude to BNDAG, to the BNDAG team, because they are doing a really nice job here organizing the seminars. We have been in 3 cities before coming here. We have had a great time. I also want to express my gratitude to Metabiome for letting me be here with you. And today we are about to, I just want to know if the sound is good for you in the translation. Good? Perfect. So today we will talk about endodontics, the main points that we need to have in mind for proceeding and for doing root canal treatments in a reliable way, and for being able to offer to our patients reliable treatments, for avoiding to extract teeth, and also for working in a comfortable manner for us. Because being a dentist is not easy. Being a dentist is stressful since we start thinking about the position. We are working every day at the dental office. We always have pain in the back, pain in the neck, because we are treating with people. It's not easy because we always want to do our best for our patients, and that's why you are here. That's why you are here. Maybe you decided to come for coming and see what's doing endodontics. We always learn in lectures. It's always nice to share experiences when lecturing and when you are at hands-on courses, for example, and it is always good. And we will be able to take that knowledge and apply it at the clinical practice. What we want to learn in this kind of events are useful things that we might be able to apply in the daily practice. And the A to C endodontic solution, or the A to C endodontic strategy, is related to the fact that our main objective in the clinical practice is this. We want to go from a situation that this one, an interproximal cavity in this molar, maybe a root canal treatment was necessary, maybe not. The patient might be in pain, maybe not. But our final objective is to achieve a result like the one that you are seeing in the left side of the screen. And for reaching that result, it's a long way to go, because we need to diagnose properly. We need to have a successful decision-making process for deciding in which way to proceed. We need to decide if it's necessary to go for a root canal treatment. We are having problems there? No? We are good? We need to understand the biological principles that we are having working here. So let's see in this lecture what are the main steps and what are the main biological principles that we need to have in mind for proceeding in a reliable way. This is part of my country. I'm from Guatemala. Guatemala is a country located in Central America, and a lot of people know who we are because of these temples. We are the land of the Mayan civilization, and a lot of people is coming and visit us because of this. But we also have the most beautiful city in Central America. Our city is really big. It's surrounded by volcanoes. You can go to Guatemala and climb a volcano. And my dental practice, my office, is located in this area. It's located in a nice area in Guatemala City, and this is the setup of my office. When I started studying endodontics, my main goal was to get graduated and to buy a microscope for working with magnification, proper illumination. I wanted to buy by that time obturation devices, endodontic motors, to use the best materials. But when I started buying all my stuff, I realized that the most important part of the treatment for being successful is to have the knowledge for being able to apply that knowledge with these tools. Because without knowledge, these tools can be useful, not useful. But my main interest in endodontics didn't born at the city. I grew up in a small town in Guatemala, really small town. And when I was 12 years old, I went to get some treatment in my mouth, and I love what the dentists do on my teeth. And I told to my mom, you know what, I want to be a dentist. And my mom just laughed at me and tell me, okay, you are going to be a dentist. But now, here I am, and I become a dentist. And I still having one practice here because I love this place, and I want to help my people. And this is the setup of the other offices. You can see it's really similar. But the treatments that sometimes I am able to do in the city are not the treatments that I am able to do in my town, because the cultural background, the economical status, and the way of thinking of the people is different in the city and is different in my town. Even if I want to do the same in both offices, it won't be possible for me because sometimes the patient don't want. And we need to do what is the best for the patient, but the patient should agree with us at the same time. So since this point, since the planning of the treatment, we start having a lot of challenges. And we need to learn how to manage and how to successfully achieve our main goals. I have had the opportunity to travel to different places. From Guatemala, I have been in Germany, Dubai, Costa Rica, now in Vietnam. And the most beautiful thing that I have learned during the last 4 or 5 years is that we are doing endodontics and dentistry all over the world in a really similar way. There are some differences because in the United States, for example, the doctors have a lot of technology at their offices because they have the economical power to buy that technology. In Central America, we do not have too much technology, but even without that much technology, we are able to work similar to the people in the United States and to achieve our goals and to achieve what we want with our patients. And this is because the biological principles are the same. The pulp tissue of one patient here in Vietnam will get inflamed if you do not have a proper irrigation in your handpiece, a proper cooling in your handpiece. The same thing will happen in Guatemala, in the United States, in Costa Rica, and all countries. That's why we are working in a really similar way. And we have been in 3 cities before coming here, and we have had a great time with great people like you, and we have enjoyed a lot. If at the end of the lecture you have any doubt, please let us know, because we have the translation, and it's really nice to have some sort of exchange of ideas. This is what we want. I want to learn from your experience, and I want to share with you my experience also. And we have had that interaction in the previous cities. We want to have the same here today. And going straight to our topic, as you can see, the root canal system is not easy to handle, because the root canal system is really complex. There are a lot of ramifications. The basic anatomy can be understandable and can be the same, but in an upper molar, for example, first upper molar, we already know that in 90% of the cases, there will be 4 canals. We know that we need to look for that 4 canals, but the anatomy of that 4 canals is gonna be different in each patient. And that's why the root canal treatment and endodontics are really challenging. We can have an anterior bit that in the x-rays may seem to have just 1 canal, but the reality might be this one. And we need to have in mind that sometimes there are more canals than we expect. And because of that ramifications, we need to look for the best way to disinfect and to work inside of that complex system. For example, in this molar, the one in the right, it seems to be an easy treatment, but the curvatures in this area, these abrupt curvatures in the apical area, are really hard to deal with. It's really difficult to get inside of that curvatures. And sometimes we reach the working length and we think that the root canal treatment is blocked, and actually it is not blocked. What is happening inside is that there is an abrupt curvature, and what we need to do is to prevent the files, and with our hands feel how is the root canal system inside, and try to go along all that abrupt curvatures, because the root canals can get blocked and they can get constricted, but it will always happen from coronal to apical. It never happens in the opposite way. So if we have a permeable canal in the middle and the coronal third, that canal should be permeable also at the apical portion. But sometimes we cannot reach the desired working length, and it might be because of curvatures like this one. These are the main scenarios that we may face in the dental practice. We need to provide a proper isolation before starting working, because without a rubber dam and without using rubber dam, the root canal treatment will fail, for sure. Without a proper isolation, if you are going to do a restorative procedure, and that restorative procedure is an adhesive procedure, and you get the working area just a little bit contaminated with saliva, your treatment will fail also. Because we have to work in a dark and humid environment, and the materials that we are using are not good for working in a humid environment. That materials need to be applied in a dry environment, and that's why the complete isolation of the operative field is really important. Sometimes we need to do root canal treatments in the anterior zone, and if the tooth is necrotic, the final decision is really easy, because the tooth is already necrotic. We need to take out that dead tissue from inside. We need to take out the bacteria from inside of the root canal. But in these cases, this case, where you start removing the caries and suddenly you have a pulp exposure, that is challenging because we need to decide, should I go for the root canal treatment? Can I avoid the root canal treatment? Is advisable to avoid that root canal treatment? If I decided to avoid the root canal treatment, we need to ask to us always, my pulp capping is gonna be successful, is gonna be reliable, and we will see all of these scenarios in this lecture. Let's look at this case. This was a patient that went to the office with an acute periapical abscess, and as you can see, the molar was necrotic with a big periapical area. The patient was in a lot of pain, and what we need to do is to create our endodontic access. We need to go inside, we need to disinfect the root canal system, and also we need to provide a good obturation of the area. And as you can see, the root canal treatment, I think, was acceptable. I decided to place in my first appointment this post-endodontic core build-up, and finishing a root canal treatment is easy in most of the cases. But what we are looking for is not just to finish the root canal treatment and that's it. What we want to see is, in the follow-up appointments, we need to see this area to start healing or healed. And we decided to call the patient for a recall. And the periapical radiograph after 6 months was this. As you can see, the periapical tissues started healing. The patient was without any discomfort, without any pain. He was able to eat both sides in the mouth, but we still having a problem there, because as you can see, the final restoration was not in place. So I asked to my patient, please go get a crown, get a final restoration, because you are in big risk of having a fracture of that molar, because it's a first molar. It will receive a lot of forces coming from the occlusion. And I also explained to the patient, if you stay in this way, we will have a risk of contamination in the area. The patient disappeared for 30 months, and 30 months after, he called me and told me, you know, Jenner, he's my friend. I'm having a lot of pain in that molar, in what you did a root canal treatment, and I am inflamed, I also have fever, and the molar is moving now. And I start thinking, what is happening here? Maybe the root canal treatment gets contaminated, maybe what I did was not so good. So I asked him, please come to the office. The agenda is full, but I'm going to make a space for you. And the scenario after 30 months was this. You see? Whose fault was? It was my fault. It was the patient's fault, maybe. It was the referral doctor's fault. We don't know, but the interesting thing here is that, as you can see, the tissues, the periapical tissues, they healed. And we have a lesion here because of the fracture. And that fracture was, I'm pretty sure that it was because of the lack of the final restoration. Without a final restoration, a root canal treatment is not successful. Even if you do the most beautiful root canal treatment in the world, but without a final restoration, that treatment is not successful. And that is the meaning of the A to C endodontic strategy. We need to start planning since the beginning, and you need to start working on the tooth, having the final restoration in your mind. Because if you have the final restoration in your mind, you will be able to have a proper clinical planning during your practice. If you start thinking just, okay, I will do this root canal treatment and that's it. Sometimes you may proceed in teeth that are not restorable, and if you are the people in charge of the final restoration, it's gonna be a big risk for you, because you will risk your work. If the referral doctor asks for the root canal treatment and you think that the tooth is non-restorable, our duty is to tell to the doctor, you know, my friend, I think this tooth is non-restorable. I think that is not advisable to proceed with the root canal treatment. And if the referral doctor tells you, I know, please proceed, do the root canal treatment, you did what you have to do. And if the referral doctor understands the problems, and if the referral doctor understands that the tooth is non-restorable, he will say thank you, because you are helping in that planning. What we have to do was to proceed with the extraction. We place some bone in the area for keeping the height of the bone ridge that area, and the patient is waiting for an implant now. We will need to place an implant. The implants are in the market. The implants are a good treatment option, but we need to start thinking in implants when you cannot save a tooth with the power of endodontics. If you are not able to save the tooth, you can proceed with an implant, because we want to have healthy patients all the time. This bone graft material, the name of this bone graft material is TM bone. It's a really nice bone from Beta Biome. It's working really good. This was the molar after the extraction. As you can see, the problem was here because of occlusion forces. And that was just an introduction, a general introduction, but now we are going to go step by step. Let's imagine that you already have your diagnosis. We have here this clinical scenario, and where we can see these big caries, these interproximal caries in the area. In the X-ray, we may suspect that when removing caries, we may have a pulp exposure. So the first thing to do is to have a proper isolation, using clamps, using rubber dam, and using this gingival barrier. This gingival barrier have a lot of applications in dentistry. We will see in which cases can we use this gingival barrier. The name of the material is Next Temple C. And after providing a proper isolation of the area, we'll proceed to remove the caries. And as you can see, we have here one small pulp exposure. Sometimes you can expose the pulp and there is no bleeding. And if you do not explore that preparation, maybe you are not going to be able to notice that there is a pulp exposure. So please, not working? I think we